Is villus atrophy a core part of celiac disease? Have you ever wondered what happens in the body when someone has celiac disease? One key aspect to understand is villus atrophy. So, is villus atrophy a core part of celiac disease? Let's break it down. Celiac disease is an autoimmune condition where the immune system reacts negatively to gluten. Gluten is a protein found in wheat, barley, and rye. When someone with celiac disease consumes gluten, their immune system triggers an inflammatory response in the small intestine. This inflammation specifically targets the villi, which are tiny, finger-like projections lining the intestinal wall. Now, when these villi get damaged, they can become flattened or shortened. This condition is what we call villus atrophy. The flattening of the villi is a hallmark of celiac disease. It directly affects the body's ability to absorb nutrients from food. When the villi are damaged, it leads to a range of symptoms. People may experience diarrhea, weight loss, anemia, and malnutrition. This happens because the body cannot absorb essential nutrients effectively when the villi are compromised. To diagnose celiac disease, doctors often perform an intestinal biopsy. This procedure allows them to observe the condition of the villi and confirm if villus atrophy is present. If villus atrophy is found, it strongly indicates celiac disease. While villus atrophy is closely linked to celiac disease, it can also occur in other medical conditions. Some immune deficiencies and other types of enteropathies can lead to similar villi damage. However, in the context of gluten sensitivity and celiac disease, the damage is a direct result of gluten-triggered immune responses. Understanding villus atrophy is essential for anyone navigating gluten-free living. The primary treatment for celiac disease is a strict gluten-free diet. By removing gluten from the diet, the immune system can calm down. Over time, this allows for the healing and regrowth of the villi. As the villi heal, nutrient absorption improves, and symptoms often lessen. Regular follow-up appointments are important. Sometimes, repeat biopsies are needed to check if the villi have recovered. This monitoring is key to managing celiac disease and reducing the risk of complications, such as lymphoma. In summary, villus atrophy is indeed a core part of celiac disease. It represents the damage caused by the immune reaction to gluten. This damage leads to poor nutrient absorption and many symptoms associated with the disease. A gluten-free diet is essential for healing and restoring intestinal function. Monitoring recovery of the villi can guide treatment success and long-term health in gluten-free living.